Miss Modi.
Good morning.
How are you today?
I'm good, yourself.
I'm doing great.
Good.
I'm here today to discuss a few things with you that you previously talked to your primary care provider about, which is a previous blood clot that you had.
Okay.
Your doctor wanted you to start on a new medication called Paxlovid, which is also known as Eliquis. Have you heard of that before?
Yes, I have.
Okay.
Yeah.
So I brought a sample with you for you to, if you want to open it and look at the pills so you know what they look like. And I brought you a sample just in case the pharmacy doesn't have any available today or you can't pick up your script, okay?
Okay.
You're going to start on that medication today. So Eliquis is a blood thinner. So a blood thinner just going to go ahead and thin your blood so that it lowers your risk of having any future blood clots.
Okay.
Okay? This medication is prescribed 2.5 milligrams per pill. So you're going to take it twice a day. So that's one pill in the morning and one pill at night. You want to take it at the same time, okay?
Okay.
You never want to crush. I mean, you can crush it. You can crush it. And you can also put it on top of applesauce if you find it difficult to swallow the pill or something.
Okay.
Don't give it to anyone else. It's your medication, okay? So you're going to take this pill for the next 6 months until your next follow-up appointment,
Okay.
where we're going to do blood work, redraw your labs, and see if we need to keep you on this medication or increase your medication, okay? This pill, you're going to take at the same time every day. If you miss a dose, you want to take it as soon as possible. Now, if it's within 6 hours of your next dose, you want to skip it, okay? And you
Okay.
start over the next day. You're going to do one in the morning and one at night.
Okay.
Okay. Some possible side effects of this medication. You're going to see easily bruising or bleeding. That's normal. Dizzy and diarrhea.
Okay.
That's another medication.
Okay.
Side effects. If you have any black Tory stool, bleeding, or vomitus in the blood, in the stool or in vomiting up, you want to call the primary care provider.
Okay.
If you're brushing your teeth and you see any bleeding gums, you also want to call and let them know. Any vomiters that have coffee ground substance in it, you want to call.
Oh, okay.
Because that means that you're bleeding from somewhere. So we have to run tests and blood work and figure it out for you.
Okay.
Okay? Now, I do understand that I gave you a lot of information, and I apologize. It is my job to inform you of the new medication you're starting on so that you can understand
Okay.
what's going on with you.
Okay.
In your own words, can you describe what I just taught you?
Yes. Okay. First of all, if I'm supposed to take the medication twice a day, and if I skip a dose, and if it's close to the next dose, I don't take that dose. I take it the next morning. That's
Yes,
correct. Okay. And I do report if I have black Taurus stools, bleeding gums, or any vomitus, any bleeding, any blood in the vomitus, and any material that looks coffee ground.
Yes. You know the normal signs and symptoms of this medication? What is it?
Dizziness, diarrhea, bruising, any prolonged bleeding.
Absolutely. Well, that's good. You discussed everything that I said. I feel like I'm confident that you could take this medication without any errors.
Okay.
So, did you have any questions for me?
No, ma'am.
I have this handout for you to take with you. So, it just basically, describe Eliquis, signs and symptoms that we discussed today,
Okay.
and you would call your primary care provider. Okay.
Alrighty.
So, if you don't have any questions for me, no questions.
No, I don't have any questions.
Okay. Well, you have a good day,
No.
okay?
Thank you, ma'am.
And I'll see you in 6 months at your next appointment.
Yes, ma'am. Thank you.
Okay, you're welcome.
All